Okay.
If you have this situation that runs in your family, 9 times out of 10, you're going to have it. Okay, so it's definitely one of those things that are genetic. Females are definitely more at risk than males, and one major thing is because of pregnancy. So with pregnancy, the abdominal weight and even obesity puts a lot of pressure on the lower extremity vessels, okay, especially those superficial veins. And so it puts a lot of pressure, therefore causing the situation. Hormonal changes can do it, being overweight, which we just said, and yes, if there's also abnormal blood flow. Now, all cases of varicose veins is not severe, so sometimes patients may have a little bit, okay, of presentation, not very symptomatic, but then sometimes it can become very symptomatic. When it's symptomatic, they will have like a heaviness feeling to the leg, burning sensation, swelling. It can get ulcerative if it gets that bad, okay, that's a more extreme case, and itchy. Treatment for varicose veins, they do have different types of therapies that is used to either collapse the vein or strip it, and they have all different types of things now. Another thing that I would add to this that's kind of missing is they do have some non-surgical treatments, such as making sure that patients have proper movement. So making sure that they're not just standing for long periods of time, because that's usually one of the main causes too, is standing for long periods of time in one position. Making sure also compression stockings is also very good in using this for this diagnosis, for this disease. Even you guys as nurses, I do hear that sometimes people that do work in hospitals, they'll wear compression stockings, okay, even if they don't have varicose veins, just to prevent it. I have a friend, she's an ER doctor, and she has 3 of her veins already stripped, well, torn out, from standing for long periods of time. So just keep in mind that that is very common and it is a possibility. Okay, and I think that's it.
I have a question.
Yes.
When I was looking up images, there was also images of the testicles having varicose veins.
I've never heard of that.
Yeah, it was really bad too.
Was it associated with another disease process?
I have no idea. It just said it gave options. It gave testicles, pregnancy, and I think like the legs or something.
I've never heard of the testicles having varicose veins. I would assume that it may be associated with another condition. Like maybe it's like some sort of infection or something that could have been going on in that area. Never heard of that, but I'll take a look into it. Okay, so we're good on varicose veins? Okay, again, this information, like I said, these topics are very simple. Okay, so let's look at next. I'd like to do DVT after varicose veins. Okay, which DVT am I using?
It's the second, the one on top.
Okay.
That one.
Okay, DVT, very good. Okay, so DVT, deep vein thrombosis, so they have the etiology here. What is the situation? This is, yes, another venous issue. This is a thrombus formation. So thrombus is one of your medical terms that I put on your list that you guys picked up today. So keep in mind that a thrombus formation is going to be a blood clot that is stationary. An embolism is when we have that particular blood clot that actually breaks off and travels throughout the bloodstream. Okay, and it's called embolism. Now, when we have a thrombus formation in this situation, this is the deep vein, okay, in the calf. And so what happens here with this deep vein, this is a situation where blood will actually become stagnant, somewhat like the varicose veins. However, the difference here is that when this blood becomes stagnant in this area, all of the blood products, the blood cells, will pull up and form a blood clot. Okay, and so they form a clot right in the vessel. So when that clot forms, this can obviously lead to a whole bunch of other things. Okay, so, okay, very nice. Okay, you guys put how that clot forms and exactly what I was just saying. Everything just kind of pulls up to the fact that it gets to that clot formation. Very nice picture. Okay, so clinical management, well, before I get into that, let me go over risk factors. Risk factors for DVT. Obesity, pregnancy, you have here prolonged standing. not just standing, let me just make a correction with that. It's prolonged standing, sitting, more so sitting. But to put it in a better category, immobility. So say for example, patients that are truck drivers, okay, that's driving for long periods of time, people that are on plane rides, okay, so some businessmen fly back and forth, okay, all over the world. People that sit, the legs crossed, okay, so things that actually block the blood flow, okay, in those regions. Definitely oral contraceptives, okay, and I'm also going to add in here smoking. Smoking is also another risk factor, and especially birth control pills and smoking together is a big no-no, okay. Birth control pills, because they are estrogen based and it does have, it's lipid based in the molecule, it actually slows down the blood, it makes the blood a little stagnant, and smoking also does the same thing. So, and they tell you that too when you take birth control. Smoking can definitely increase your risk for DVT. And cancers. Okay, cancer because of the bone marrow suppression and possibly slowing down the blood. Okay, now signs and symptoms. Okay, these patients will have all of the signs of inflammation. So pain, heat, redness, tender to the touch. And so sometimes patients, when they do have these signs and symptoms, they may not know it's a DVT. They think maybe just, you know, the calf is just inflamed from maybe a workout or whatever, but not realizing that they have this situation going on. Okay. Now another piece to this, we all know that DVTs have to be taken care of immediately. Okay. And I want you to jot this down. DVTs, for some reason, have a behavior of breaking off and going into the pulmonary circuit. So DVTs have a behavior of breaking off, God bless you, and going into the pulmonary circuit. And so DVTs are definitely a risk factor for pulmonary embolism. Okay, DVTs are definitely a risk factor for pulmonary embolism, which is why when this is discovered, they have to take care of it immediately. Okay. Missing treatment.
Oh,
Where is it?
oh, it's under the clinical.
Oh, I'm sorry.
practice.
Oh, sorry. Treatment is definitely going to be any type of blood thinners or anticoagulant therapy, okay, to definitely break up that clot and thin out the blood that's stagnant. Another thing too that can be used is, yes, definitely leg compression. So, another thing too, a very good example of a patient that's at risk for a DVT, say for example a person that has a fracture, okay, to a long bone, say the femur or whatever, they're laid up, okay, for how many days, okay, in this position, not moving around, that person is definitely more at risk for a DVT, okay, than anyone else, because of the immobility. They just had an injury to the region, okay, so obviously blood is going to be slower in that area. So, and with the immobility, that really causes the blood to be stagnant. So they're definitely at risk. So, post-op patients that are more so like extremity type things. And I think that's it. Okay, very good. Burgers. So Buerger's disease and Raynaud syndrome, these two disorders are a lack of blood flow disorders to the fingertips. However, they both have different pathogenesis, okay? So we'll go into the difference between the two. Now, when you look at Buerger's disease, okay, this particular disorder, just to sum this up, they do believe that this is an inflammation that happens in the vessels that decreases the blood flow to the extremities. Okay, and we know that this is the farthest place, okay, blood gets to. So the fingertips, sometimes the toes, but the fingertips are usually more common to be affected. And so again, it's an inflammatory change, inflammatory process that is in the vessels that blocks the blood flow getting to the fingertips. Now, why do these individuals get this inflammatory change and a lack of blood flow? Smoking, okay. Berger's disease is definitely associated with smoking, and so they do believe, especially chronic smokers, can have this condition. And as you can see, the finger can get to the point where there's such a lack of blood flow to the tissue gets necrotic and lead to that. Okay. When they do have signs and symptoms of this, they could have like maybe some numbness and tingling, some pain, maybe a cold feeling, okay, to the fingertips. So they will have signs and symptoms of this before it gets to that stage, okay. But if it's not treated, in a timely fashion, that could happen. They even had a smoking commercial a couple of years ago that actually showed a picture like that, okay, of a person with this. And so treatment. Before it gets to that stage, treatment is to do anything to try to increase blood flow to the fingertips. So they can use maybe, let's say, vasodilators, they can use calcium channel blockers, anything that's going to sort of relax that vessel to get the blood moving. Also, what you guys have for treatment? Yes, relieve the symptoms, exercise, so anything that could, increase blood flow. Yes, and for severe disease, a lumbar lumpectomy to increase blood flow. I've never heard of that particular procedure. But okay, they can do another procedure to increase blood flow. But if it gets to that point, yes, amputation. Okay, if it gets to that point of gangrene tissue. Okay. I think that's it. Yeah, that's it for burgers. All right. So right now, the next one. So for Raynaud's syndrome, this, as you can see, is also affecting the fingers. But in this situation, the main pathogenesis here, etiology, is that it is a constriction, a vasospasm of the vessel. So the vessel is in a vasospasm, okay, and this is why they don't get enough blood flow to the fingertips. Why does this vasospasm happen? The etiology is kind of unknown in that sense. Why is it in a spasm? But it goes into a spasm. Okay, so we're going to go over some possible risk factors here. Okay, so risk factors. They say women are definitely more prone to having this. People that live in cold climates definitely have this a little more. Okay, family history, possibly age and stress. Now, as far as secondary Raynaud's, there is a condition, or I should say a term called Raynaud's phenomenon. So the Raynaud's syndrome is when the person has a vasospasm of the vessel, and that's like the primary diagnosis. But sometimes people have diseases or conditions, and as a secondary symptom of that condition, they'll have the Raynaud's phenomenon. They'll have the numbness and tingling or coldness to the fingertips, but it's because of the primary condition. So it is a difference between Raynaud's syndrome and Raynaud's phenomenon. So signs and symptoms, yes, they will have that blue palish to the fingertips, numbness, cold, tingling. Okay, so all of that is if you were to think of being in the cold very long time, okay, and what's going to happen to your hands. And treatment. Calcium channel blockers, alpha blockers, vasodilators, anything that's going to sort of relax the muscular wall of the vessels, open up that vessel, get the blood flow, okay, so they can get better. Sometimes surgery, injections, amputation if it gets to that point if they need, if it gets to a necrotic situation. But one thing I want to say about Raynaud's, it's not easy to treat, and sometimes each treatment works differently for different patients. I remember one time I saw a person that she suffered from Raynaud's, and she actually used the hyperbaric oxygen chamber. If you guys ever seen those, and by going in the hyperbaric oxygen chamber, that actually helped her increase her blood flow to the fingertips, and that helped her a lot. Okay, for the Raynaud's. So believe it or not, they have all types of treatment. It all depends on what works for that individual. Okay. Okay, very last, is this the last one? Aneurysms. Okay, very nice. So for aneurysms, I'm gonna give a little more pathogenesis. Okay. Pathogenesis of aneurysms is this. I just want to start off with explaining what an aneurysm is. Now, an aneurysm is when we have the wall of the vessel that actually will start to weaken to the point that it will stretch and stretch, okay, and stretch. Now, some books, they call it like a defect in the media, you know, the wall of the layer and so forth. Yes, it is a defect. However, there's usually going to be something that causes that issue to happen in the first place, which is going to be a pooling of blood. So you will have a pooling and pressure of blood in a particular artery that will cause that vessel wall to stretch to the point that it forms this abnormality called an aneurysm. Okay, so an aneurysm is a bulging effect that happens from the vessel wall. Now, in your PowerPoint, they give you, I want to say, two different types where it bulges on one side and then sometimes it can bulge on both sides of the vessel. Okay, so there's different ways that can occur. However, we all know if an aneurysm continues to bulge to the point that it ruptures, we know that this is fatal. Okay, and so that blood can pool out into the tissue space, and that's a whole other problem. Now, what can cause this sort of bulging and building up of blood and pressure and all that in the first place? The risk factors, number one, smoking. Okay, we all know smoking is a risk factor for a number of things, respiratory and a number of cardiovascular diseases as well as cancer. Hypertension, that is also a number one risk factor. Hypertension, and that makes sense because if you have a high pressure in blood, especially flowing through arteries, all that pressure bulging up, that is definitely going to cause that vessel to I don't want to say tear, but just bulge. Over 40, family history, gender, again, not men, well, women, they say, are more common than men, and if there is a possible tumor. Okay. Signs and symptoms. Okay. Oh, good. I'm glad you guys separated cerebral. Who did this? Okay. I'm glad you guys separated cerebral from cardiovascular, because I did want to go over the difference, and I forgot to tell you guys the difference between cerebral and abdominal aortic aneurysms. Okay. So very good. Now, when a patient has a cerebral aneurysm, that is actually one of the most common types of aneurysms, cerebral aneurysms. And we would imagine, obviously, headache. Okay, headache, and think of any type of also signs and symptoms that comes from an alteration of the neurological system. Whether it's poor vision, nausea, vomiting, stiff neck, sometimes they can even have numbness and tingling, okay? Definitely increased intracranial pressure, especially in those situations if we're talking about a bursting aneurysm, okay? And when we go over, I want to say week 7, we will cover acute brain disorders, okay? We're going to talk about this again, okay? And so for the cardiovascular aneurysms, these patients can definitely lead to hemorrhagic stroke, okay? Again, if we do have that bursting aneurysm. Sudden pain, yes, that radiates to the back or the abdomen. And that, for the back, is actually for abdominal aortic aneurysms. So when we think of abdominal aortic aneurysms, we would think, oh, maybe they have pain here in the stomach area. No, they do not. The pain is actually in the back. And the reason why, because the abdominal aorta, remember, lies right above the vertebrae, which is more retroperitoneal. However, if you were to palpate the abdominal cavity around the navel, and you feel something pulsating in your hand, that's a telltale sign that that's probably an aneurysm there, okay? Nothing should be pulsating this way in your hand if you're just kind of pressing around that region. And shock, yes, can occur, and renal failure, and paraplegia, if it gets to that point where it destroys the nervous system. And treatment. Okay. So treatment, emergency situations, because usually it is a high pressure in the vessel, definitely controlling the blood pressure is the number one thing you want to do, okay? And then obviously for those that are bursting, when an aneurysm has burst, okay, one thing that needs to be done is a clipping to stop that blood, so you want to clip that vessel. However, if they can get to it in a timely fashion, because we all know that sometimes that doesn't get to that point. Using vasodilators again to kind of open up and move that blood around so we don't have all that force. And any type of surgery that needs to be done to repair that vessel. One of my friends put on Facebook, I should have saved it for you guys. It was a really nice surgery of how they actually extracted this blood clot out of the vessel. I'll try to show you next time because I have to find it. I don't even think I don't know if I have it on Facebook. Yes.
After the vein is stretched out, is there any way for it to go back to its normal?
If you take out the blood, it'll go back to normal. Yeah, because it is a muscular layer, so it'll move back. But it's just because that blood is making it
Hold.
out. Now, to say that, is it more vulnerable again to do that? Yes, so you want to be careful and make sure the blood pressure is under control.
So it doesn't really fully regain its elasticity?
I'm sorry, say
It
that.
doesn't fully regain its natural
No,
elasticity?
it won't fully regain its natural elasticity, even though it'll go back, but it's still a little vulnerable to going back into that stage again. Okay, so we're all done, and so